Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share. Our hands are marvels of engineering, enabling everything from delicate surgery to heavy lifting. Every day, we rely on them for countless tasks, both big and small, from the most precise movements to the most forceful actions. This incredible versatility comes from a complex network of bones, tendons, ligaments, and nerves all working in perfect harmony, allowing for both strength and dexterity. Each part plays a vital role in the hand's function. Yet we often take our hands for granted, rarely noticing their importance until injury strikes, and suddenly even simple actions become difficult. Even a minor finger injury can disrupt daily life, making it hard to write, type, or even hold a cup of coffee. Hand and finger injuries are surprisingly common, occurring during sports, at work, or even while doing simple household chores. These injuries can range from minor cuts and scrapes to severe fractures and tendon damage that require urgent medical attention. Two notable injuries, mallet finger and intercondylar fracture, highlight just how vulnerable the hand's intricate structure can be. Mallet finger affects the tendon that straightens the fingertip, making it impossible to fully extend the finger without help. An intercondylar fracture, on the other hand, is a break within the finger joint itself, often causing swelling, pain, and loss of movement. Both injuries are painful and disabling, but they require very different treatments and approaches to healing. Let's explore how these injuries happen, how they're diagnosed, and why prompt, specialized care is crucial for the best recovery. Mallet finger, or baseball finger, is a tendon injury that prevents you from straightening the fingertip. It's usually caused by a sudden blow to the tip, like catching a ball or tucking in bed sheets, resulting in a drooping fingertip. Intercondylar fractures, in contrast, are complex breaks at the finger's joint surface, often from high-impact trauma like slamming a finger in a door. These fractures split the bone into multiple pieces, disrupting joint alignment and risking long-term problems if not treated precisely. Mallet finger is a low-energy injury. Intercondylar fractures require significant force and are less common in everyday accidents. Understanding the difference is key to proper treatment. Mallet finger is usually easy to spot. The tip of the finger droops noticeably, hanging lower than the rest of the finger. This happens because the tendon that straightens the fingertip is damaged or torn. The affected fingertip can't be straightened, even if you try, while the rest of the finger and hand often move normally. This makes the injury quite distinct from other finger problems. There's usually pain, swelling, and sometimes a small lump or bump at the end joint. Bruising may also develop, and the area can feel tender to the touch. Intercondylar fractures, on the other hand, cause severe pain, significant swelling, and obvious deformity around the middle knuckle. This type of injury often makes finger movement difficult or even impossible. Sometimes, a grinding sensation or instability can be felt when the finger is moved or touched, which is a sign of a more serious injury. Doctors diagnose mallet finger by carefully observing the characteristic droop and testing the ability to straighten the fingertip. They confirm the diagnosis with an X-ray, which helps check for any bone fragments or fractures at the tip of the finger. Intercondylar fractures always require X-rays to reveal the exact fracture pattern, the amount of displacement, and to guide treatment decisions. In especially complex or severe cases, a CT scan may be needed to provide a detailed 3D view for surgical planning and to ensure nothing is missed. Accurate diagnosis is crucial, as it ensures the right treatment path is chosen and helps prevent long-term problems or loss of function. Don't ignore these signs. Early intervention and proper care can make a big difference in recovery and finger function. Mallet finger is most commonly treated with a special splint that keeps the fingertips straight and immobile for 6 to 8 weeks. Absolutely no bending is allowed during this period. The splint must be worn at all times, even while sleeping, to ensure proper healing and prevent the tendon from detaching again. Consistency is key for the best results. If the injury involves a large bone fragment or if the joint is misaligned, surgery may be necessary to restore normal finger function and alignment. This is especially true if the joint surface is disrupted or unstable. Intercondylar fractures, which are more complex, often require surgical intervention to realign and stabilize the bone using pins, screws, or plates. This is crucial when the fracture extends into the joint or if the bone fragments are displaced. Non-surgical treatment is rare for these injuries and is only considered when the fracture is perfectly aligned and stable, with no risk of shifting during healing. Recovery for mallet finger focuses on gradually regaining flexibility and strength after the splint is removed. Gentle exercises, often guided by a hand therapist, help restore normal movement and prevent stiffness. Rehabilitation for intercondylar fractures is more intensive, involving a period of immobilization, careful pain control, and structured therapy sessions to restore motion, reduce swelling, and prevent long-term stiffness or loss of function. The ultimate goal for both injuries is to restore full function, maintain range of motion, and prevent any long-term complications or deformities. Following the prescribed treatment plan closely, attending follow-up appointments, and communicating with your healthcare team are all essential steps for achieving the best possible outcome. Ignoring a mallet finger or failing to follow splinting can lead to permanent fingertip droop and even joint deformity. Intercondylar fractures, if not treated properly, can cause chronic pain, stiffness, arthritis, and loss of hand function. Misaligned healing may require further surgery and can permanently affect grip and dexterity. While mallet finger complications are often cosmetic, intercondylar fractures can be disabling. That's why precise treatment and rehabilitation are critical. In summary, mallet finger is a tendon injury, usually splinted. Intercondylar fracture is a complex bone break, often needing surgery. Both demand prompt medical attention and strict adherence to treatment. Protect your hands, they're essential for everything you do. UMCC, your ultimate medical consultant connector.